Something terrible happened inside this Colorado jail. In 1 year, 9 people died, some who had treatable illnesses. And now jail medical staff are being forced to answer questions under oath about conditions inside.
Do you agree with this testimony that Wellpath staffing put staff in the position to routinely jeopardize patient care?
Object to form.
Yes.
These are 2 former Wellpath jail nurses who were just deposed this year.
Do you agree that Wellpath in 2022 had a staffing system in place that routinely required staff to practice outside of their licensure scope?
Yes.
These depositions are part of just one case out of more than 50 lawsuits against Wellpath we counted in Colorado federal court since 2020. Lawsuits filed by detainees and families of dead inmates who say Wellpath is a for-profit healthcare company that routinely understaffs jails with unqualified nurses.
My brother was very into his family, wanted to do good, always spending time with his son.
Cisto Kett is among the 9 inmates who died in 2022 in El Paso County's jail. Taxpayers gave Wellpath $9.1 million after it convinced the county it provides high-quality, compassionate care to vulnerable patients.
Just his laugh and his, he was always nice. He probably had more friends than I did.
In April of 2022, police arrested Kett at the hospital after a fight.
You good?
Before he could see a doctor for his pain, police took him to jail.
That's all I really know.
It's watery, like I want to throw up.
Jail video provided by the Kett family attorney shows him wincing in pain as he's processed by a licensed practical nurse, or LPN. An LPN is the type of nurse licensed to do basic care like check blood pressure and give ibuprofen. They are not licensed to diagnose incoming patients, but lawsuits say Wellpath makes them do it anyway.
They don't have the staff to do it, they don't have the training to do it, they don't have the licensure to do it, and people like Chris die when they don't need to.
That is Anna Holland Edwards, the Kett family attorney who has filed several lawsuits against Wellpath. She says underqualified Wellpath medical staff not only repeatedly ignored Kett's painful cries for help, but ignored jail deputies who asked them to intervene.
This wasn't some stealth, complicated condition. It was an emergency that was obvious to everyone except the medical staff who wouldn't even go look at him.
In this case against Wellpath, one of the LPNs working that night admitted she was often forced to be the lead medical professional on staff.
They would usually just say, well, there's no one else coming in and we don't have staff, so.
So you basically were in a position to choose no care for the people that were there that night, or care, or have to practice outside your scope.
Correct.
3 hours after deputies alerted medical staff Kett needed help, an LPN sent over-the-counter pain meds to his cell. Hours later, video captures his lifeless body on the ground when deputies noticed Kett's moaning stop.
Family days are never the same when you have somebody missing. So some days I wake up and, I'm okay, and other days I wake up and I miss my brother a lot.
26 hours after entering jail in pain, Kett died of a perforated ulcer, according to his autopsy report, a medical condition that should not be fatal. That's if the right kind of health care is available.
Instead, profits get put over people and over inmates. He's kept in the jail and he dies an excruciating and needless death.
No, nobody should expect their family to go to jail to die. I would like to see less families have to go through this kind of stuff.
In Wellpath's written response to the Kett family's lawsuit, attorneys for the company called it frivolous, saying he died of a pre-existing condition. Wellpath sent us a statement tonight that reads in part, "We've worked to tirelessly address the nursing shortages that are being felt across the healthcare industry and were significantly exacerbated by the COVID-19 pandemic. Our employees are faced with significantly challenging clinical environments." By our count, Wellpath has 4 active contracts in Colorado right now. They bring in about $30 million a year on several major counties in the metro area, 4 of them. Yeah, so they're still active.
So it's sort of a question between are they staffing appropriately on purpose, or are they unable to fill positions? And that's kind of the two arguments here.
Yeah, and that's a question for Wellpath. You know, they're saying there that there's a nursing shortage, but others say that they're a for-profit company and they're motivated to get the the cheapest labor out there, so the people at the top can make money.
Suppose both could be true. Huh?
Yeah.
All right, Jeremy Hole, thank you.